Hey everyone, how's it going today? My name is Zach Courier, and I am joined by Dr. Mani Zadeh today. How you doing today, doctor?
I'm doing well. Yourself?
Doing really well. Yeah,
Good.
you're joining us from Century City, California, way off the ground there. What floor are you on right now?
I'm on the 17th floor.
17th floor. Wow, getting dizzy just looking at your screen there. Yeah, so it's Amani Zadeh ENT. You have the one location over there. We were just talking offline about your beautiful website. How long have you been in your own private practice, and how long has this ENT journey been? Right.
So I moved to Los Angeles to this very spot, to this location on the 17th floor in 2003, and I've been here since practicing ear, nose, and throat.
Excellent. And you are a UCLA alum, right? So
I
not
am
too
UCLA
far.
alum. That's right. I went to UCLA for undergrad.
Excellent. Tell me about yeah, how you got into just the science, ear, nose, and throat, and kind of your passion developed for that.
Honestly, it was just good fortune, I think. I went to UCLA. My interest was initially research. So I started doing research in endocrinology. And when I went to medical school, I pursued that and I fell into thyroid surgeries and observing them. And a lot of ear, nose, and throat doctors were doing that at medical school. So I started following them and I just fell in love with the field, with the anatomy, with the instruments, and with the tools. And that led me to become a rhinologist, which is a nose doctor.
Right. So you do a little bit of every. You do cosmetic as well, right?
Actually, I don't.
Oh no.
I'm one of the rare ENTs that does not do any cosmetics.
Gotcha.
My focus is really nasal surgery, but specifically nasal and sinus surgery for nasal obstruction and sinus infections. Those are the main two things I treat.
And that affects a few people here and there, right?
My God, yeah,
And tell
very
us
common
about,
problem.
what part of the population, right? We just, assume symmetrical face, everything's symmetrical and perfect in there. What is that? Who does that affect? What do symptoms look like? Who comes to see you?
No, absolutely. It's a very prominent problem. The sinusitis and nasal obstruction is very prominent because all of us have experienced nasal obstruction, nasal congestion, allergies, and all those fall within the umbrella that I treat. The typical patient that presents to my office is in one of two categories. One category is someone who's just having difficulty breathing through a nose, or they're having a lot of discharge from a nose or sinus pressure, and they come in for an evaluation. The other group is a group of people who have had chronic disease for a long time, have been told they need surgery, and they present for surgical treatment. In general, these groups are diagnosed with one of three things. One of it is an anatomical problem causing nasal obstruction. The nose, just to give you a very brief anatomy lesson, the nose basically is two nostrils that go all the way to the back. And they're divided in the midline by a midline structure called the nasal septum. It's a small wall that divides the nose into half. Everyone's septum has a slight deviation, but when its deviation is extreme or if it's quite extensive, which is bent this way or the other way, it can cause a limited airflow on one side or the other, which can be perceived as nasal congestion or obstruction. So anatomically, if the tissues in the nose are enlarged, if there's a polyp in there, or if there's a nasal septal deviation, that can cause blockage. Another category is people who have allergies, and these are patients who have seasonal problems. So they come in with nasal congestion, a runny nose, and they say, listen, I feel fine when I'm in the desert, but when I come to play golf, I get these symptoms. So I'm great in the summer, I'm bad in the winter. I never pattern to their symptoms. And these are people who have something in the environment causing their symptoms. And the third category are people who have perennial symptoms, meaning they have it year round. And these patients are the ones who have chronic congestion, sinus pressure. And you look inside their nose, it doesn't look too bad usually. You don't see a big obstruction from the septum or large tissues blocking the way. But when you investigate further, when you do imaging or do endoscopy of the nose, then you notice that they have sinusitis, and that's causing their symptoms. So it's either anatomy, allergies, or chronic sinusitis. The main three things why the patients present in my office.
Yeah, and from what I hear, people like to walk around and live with these and sleep with these, noses and sinuses, right? That are obstructing their breathing, affecting their sleeping, affecting really the quality of life. What is it about people that we're willing to walk around and kind of deal with this kind of pain?
That's a great question. The truth is, humans are just very resilient. We adapt, and we
Yeah.
adapt as this pandemic has shown us. We can all adapt. So the truth is that humans are resilient and we get used to things. So
Right.
if someone turns off the switch suddenly and the nose goes from open to blocked, you're going to feel pretty miserable. But if there's a slow progression of nasal obstruction or congestion, you get used to it. But oftentimes when you reflect back, you say, oh my God, yes, when I exercise, it's very difficult for me to breathe through my nose. I'm breathing through my mouth goes dry. Or I'm snoring a little bit at night now because my nose is plugged. I wake up in the morning and my throat is very dry and parched because I'm breathing through my mouth, not through my nose. Because the nose has a lot of functions, obviously. So when these functions are taken away because the nose is blocked, then you got to start noticing slight symptoms here and there. And eventually, it may mount up enough to cause symptoms. But on the other side, it may not be enough symptoms. And you may say, you know what, I have it, but it doesn't bother me enough. I'm going to leave it alone.
Yeah, for sure. Personally, I've been told that before, that I have a slightly deviated septum, but if it doesn't, it's probably more comfortable for me to sleep on one side than the other, but it doesn't affect me, every day or every night, right? So, how do you, I'm sure you see people sometimes that go, hey, if it's not bothering you that much, don't worry about it. And then others that are saying, you know what, this really manifests itself in a tough way that even down the line, right, can result in bigger issues, right? Bigger health problems.
Yes. No, that's a good question. So that, usually the first or second question I ask the patient is, why are you here? What bothers you most? And the truth is, sometimes the answer is, I can't sleep. It's bothering me a lot and it's affecting my quality of life. And those I do take obviously very, very seriously. But there's other times when they will say, someone at some point told me I have a deviated septum and I want to get it fixed. And when I investigate further, they don't really have any symptoms. They just feel a little stuffy on occasion. It doesn't affect their quality of life. And in those patients, I tell them, listen, if it's not affecting your quality of life, so long as the exam merits this diagnosis, and so long as it doesn't have anything long-term that I can see, I say if it doesn't bother you and there's no long-term repercussions, leave it alone. Don't do anything. Come back when it's symptomatic for you.
Absolutely. And you're in Southern California, obviously been pretty strict over there with all things global pandemic, shutdowns, right? And the flip side, people have, more time on their hands, right? They have a chance to maybe take care of that right now. But what would you say to folks that are like, maybe I'll wait until we have a vaccine, or I want to, stay safe or whatever, but maybe they're still dealing with some pretty rough symptoms in the meantime?
That's a good question. So there's a couple of avenues. Obviously, if they're having significant symptoms, they can still be seen safely in the office. We take a lot of precautions, and so far it's been very successful in allowing patients to be seen by doctors safely. If the symptoms have been there for a long time and they're mild, and at some point they've been assessed and the symptoms are not significant in terms of affecting the quality of life, we do recommend for them to wait. And the reason is because if it's waited 5 years, another 6 months is not a bad idea, just to be safe for the patient, but also B, if God forbid there's a need for the hospitals or the ERs, we don't overwhelm the system by having a lot of elective surgeries go at once. But most of these situations with nasal congestion and sinuses are chronic and they can wait. But obviously, if you're uncomfortable, there's many ways to be seen, including telemedicine. And that's another option as well.
Absolutely. And then also, I was looking at your website too. You also deal in, throat and a lot of voice type things, obviously the industry out there and people need their voice, regardless, no matter what you're doing. What do you see typically out there? I imagine you probably have some high profile clients that come to you with that. Yeah.
I think, it's the nature of the location. Century City, Beverly Hills. So we do get a lot of high profile patients that come through. But because of my expertise in the nose, a lot of times they come through because the nasal congestion or post-nasal drip is affecting their voice. So what happens is that, and it's an important subject because what happens is that if you have a stuffy nose or your nose drips down the back, that these mucus that goes down the back can irritate your voice box and it can irritate your vocal cords. And as a result, you may get a raspy voice. You may have the patient have to go clear their throat a lot. And that, as a result, causes a lot of irritation in the voice box, again, causing a change in the pitch and so forth. And that we treat. On the other hand, you have to be very sensitive because a lot of the medicines we use to treat nasal congestion and a lot of medicines we use to treat nasal drippage or post-nasal drip tend to have some adverse effects on the voice box. So in these particular individuals, we do change the treatments slightly to preserve and avoid any trauma or any irritation of the voice box and affect their voice.
Excellent. And then pretty much, just wrapping it up there. If someone comes to you for a procedure or, needs something, what can they expect as far as what insurance covers? What does downtime look like, depending on the
So,
treatment?
so basically, the most of the nasal procedures that I do are covered by insurance. I don't contract with insurances myself, so I go out of network for insurances.
Mhm.
But the insurances do cover most of these. So a lot of times the patient is able to submit this to insurance, so we submit it on their behalf, and they do get a reimbursement on occasion. And we can definitely investigate all that before anything is done, so there's no surprises on the other side. With regards to the recovery time, it really varies depending on what we do. There are office-based procedures that we do that can, you can drive home yourself and go back to work the next day with no issues. And then there's surgical procedures where we do very extensive sinus surgery, and I do very extensive sinus surgery, and that requires usually about a week downtime. Most nasal procedures require about a week downtime. I would say at the most, very rare situations, it can be longer, but oftentimes by day 4 to 5, you're good to go.
Well, that's good. And we've got some downtime, some obvious downtime coming up here shortly. So,
Oh my God,
for sure. Well, Dr. Zadeh, I really appreciate it. Thank you so much for sitting with us and chatting and just kind of going through, some of those symptoms that people are experiencing and the pros and cons of maybe, focusing on that, sooner than later, obviously.
yes.
Plus, if you like heights and you like the view, not a bad place to check out. So.
No, absolutely.
Well, thanks again so much for your time. Stay well, keep up the good work, and we're almost done with this year, almost to the end.
Oh my God, yes. You take care. Thank you for your time. I
Absolutely.
appreciate it. Thank you.
Yes, sir. You too. Bye.
Bye-bye.